So good morning and welcome to this week's Core Coffee Chat on using health in all policies in our COVID-19 response and recovery. We're so excited to have Mimi Hall join us this morning as our special guest. Mimi is the director of the Santa Cruz County Health Services Agency. And so if you know anything about Mimi or anything about public health and health services agency, she and the department have been right in the thick of the COVID-19 response from the very beginning. And I think we're all very fortunate to have her leadership and the leadership and wisdom of Dr. Newell to guide us through this current pandemic and help us get through to the other side as we start to think about recovery, long-term resilience. And also just want to say a special thank you to the City of Santa Cruz for co-sponsoring this coffee chat and actually reaching out to us and suggesting this as a topic. It was a perfect match, and it's been a great collaboration to plan this together. So I'm Nicole Young. I'm one of the consultants that co-facilitates the Core Investments Initiative, and I'm joined by my co-host,
Nicole Lezin, the other Nicole.
And if you've joined us for coffee chats before or longer core conversations, you've heard us talk about CORE, which stands for the Collective of Results and Evidence-Based Investments. And it's both the funding model that the county and city of Santa Cruz adopted a few years ago as their method of funding safety net services in the community. But it's also a movement that has really evolved and grown over the last couple of years. And when we talk about this movement, it really means looking at and identifying ways that all of us can be part of creating opportunities and systems to achieve equitable health and well-being in Santa Cruz County using a results-based collective impact approach that's responsive to community needs. And with a lot of input and partnership from people from local government and philanthropy and nonprofits and community groups, we've arrived at these mission and vision statements that you see on your screen that are really about inspiring and igniting collective action and creating an equitable, thriving, resilient community. And you can see equity is front and center in all of these statements. And we've worked really hard to define what that means and make it an inclusive discussion as we really think about how to achieve this vision in Santa Cruz County. And when we talk about equitable health and well-being, we talk about creating and ensuring that there are equitable opportunities for people to experience these 8 connected core conditions for health and well-being across the lifespan. And that people's opportunities and their life outcomes aren't predictable for better or worse by things like race and ethnicity, income level, gender identity, immigration status, or any number of identifying characteristics. And we've mentioned these core conditions in other coffee chats as we've described and given examples of how they're connected and how well-being and inequities in one condition are often connected to well-being and inequities in another condition. But it's been a while since we've actually gone through kind of the definition of what we mean by these and all that they include. So we thought, given today's topic of health in all policies, that this would be a good opportunity to just quickly run through those definitions and talk about how policies can impact each of these core conditions. So starting with health and wellness, and really the thing to point out here is that we're talking about holistic health, that we would want people to be able to experience equitable opportunities to achieve optimal health in terms of physical, mental, social, emotional, behavioral, and even spiritual health across the lifespan. So when we think about the role that policies play in health and wellness, we can think about the effects that policies can have that determine things like health insurance coverage and access to care and access to healthy food or access to safe walking routes to schools. And so that's just a few examples that we wanted to name. Another core condition, lifelong learning and education, meaning that there are opportunities for high quality education and ongoing learning opportunities from birth to end of life. So again, when we think about policies, they affect everything from the resources that schools have that are available to them, how teachers are trained, the curriculum and testing that are implemented, how schools administer discipline. And so each of those policy choices have equity implications as well, again, for better or for worse.
And similarly, for economic security and mobility, we think about factors like having stable employment, livable wages across different industries and sectors, food security, so important right now, but always important underneath any current situation, being able to afford basic needs for individuals and families, and accumulating wealth and assets across generations so that families can prosper. Policies affect every one of these, from things like redlining that affects the neighborhoods that people are able to live in, bank lending practices, access to capital, predatory lending, and livable wage ordinances and laws. Thriving families is another core condition that has a lot of different variables to it. So the safe, nurturing relationships and environments that happen, that support families and promote the optimal health and well-being for everyone of all generations in a family. And of course, policy supports really affect these kinds of outcomes as well. So everything from paid leave that we just mentioned, the health insurance coverage that Nicole mentioned related to health and wellness. These are all illustrations as well of how connected all of these core conditions are. Access to quality childcare can be a huge factor in whether a family is able to thrive.
And the next core condition, we call it community connectedness. And so that includes many different forms and ways that individuals and institutions are connected in our community and create that sense of belonging, that we would see diverse and inclusive neighborhoods and institutions, vibrant arts and cultural life, and civic engagement. So just for example, when you think about, again, how policies relate to this, there are policies that can either promote and encourage civic engagement, like making voter participation easier and more accessible, or actually create barriers to voting and civic engagement. So policies can have tremendous power in terms of community connectedness. And another core condition, healthy environments, thinking both about our natural environment being clean and safe and sustainable, and then the human-made environments and structures that can either support health and well-being or, again, create barriers. So a lot of opportunities to think about the impact of policies in creating healthy environments. This is actually something we talked about a few coffee chats ago. You think about policies that affect transportation systems and carbon emissions and pollution and recycling. Again, all of these that can contribute to or take away from healthy environments.
And a safe and just community includes things like a fair, humane approach to ensuring that we all can enjoy the same levels of safety and trust and respect and dignity in our workplaces, in our neighborhoods, in our homes. It's not a huge leap, especially right now, to think about the many policies that affect whether or not we can enjoy a safe and just community. It's on all of our minds in the wake of the murder of George Floyd and the different ways that law enforcement has responded to protests and continues to. Stable, affordable housing and shelter is a supply question, as well as different policies that might make more shelter available to people, like zoning restrictions or eviction laws.
And so we're so, I think, excited and grateful for this opportunity to talk about health and all policies and core investments together, because they're so well aligned. And as you'll hear in a few moments from Mimi, as well as some of our other co-facilitators today, that both of these concepts, health and all policies and these core conditions for health and well-being, really speak to the connections and the intersections between all of these. And so in every core condition, we can identify past and current policies that either create or reinforce structural inequities. So when we think about our laws or ordinances or even organizational policies, they can become barriers to equity, or they can become facilitators of equity, or even mitigate and eliminate some of those historical gaps and inequities that we see today. And as always, we like to emphasize that equity is at the center of this diagram to illustrate that, you know, we have to be able and willing to acknowledge and name the inequities and the disparities that exist, but then take collective action and specific action and think about the policies, the programs, the practices, the systems that are needed to change those conditions that create equitable opportunities and outcomes. And so this series of core coffee chats and the longer core conversations that we've been holding on racial equity are just some of the ways that we are trying to build shared knowledge and inspire that kind of collective action among funders and policymakers and service providers and community members through this umbrella that we're calling the Core Institute for Innovation and Impact. And so as we continue on, we plan to offer other trainings and technical assistance and coaching and peer learning opportunities to really build out kind of a fuller menu of things that are available through the Core Institute. But these core coffee chats have been a great way to, again, learn about different topics and connect with each other. And so we're very pleased to have our guests with us today. So Nicole,
Thanks, Nicole.
I will turn it over to you.
To move on with our presentations today and to set the stage for what Mimi Hall is going to talk about with us, we have Martine Watkins, who's a current Santa Cruz City Council member and former mayor, and Elisa Arona, Executive Director of the Health Improvement Partnership. And they're going to provide an overview of health in all policies before we hear about some of the specific applications here in Santa Cruz. So Martine, I'll turn it over to you.
Wonderful, thank you. Well, good morning, everybody, and thank you, Nicole for the really thorough and comprehensive overview of CORE and those elements that go into what instinctually I think we all feel when we think of the characteristics of a healthy community. So as Nicole mentioned, my name's Martine Watkins, and I'm currently a City Council member for the City of Santa Cruz. And when I talk about health in all policies, I have to first start by crediting my older brother, who is a public health professional in San Mateo County. And when I was running in 2016, he introduced this framework to me. And it really just resonated personally as really these elements and values that I think as policymakers, many of us hold, but how to actually put those into practice when we're working on our different policies in our roles as government policymakers. And so I want to just say that, you know, for us thinking about health in all policies, these are the three pillars that we can look through when we're designing our policies and moving forward. So I'll go ahead and have maybe you move forward with the next slide, please, Nicole. So although the equity, sustainability, and the health are sort of these prisons of values as we think about health in all policies, these are the five really elements that go into the framework, and really thinking about how are we as government policymakers promoting health, equity, and sustainability in the decisions that we make? How are we recognizing that we alone aren't responsible for what comprehensively a healthy community looks like? And how are we seeking opportunities to have co-benefits within our multiple partnerships? Creating structural processes, and really how do we operationalize these values? How do we work with our community and other stakeholders? And then how are we supporting this intersectoral collaboration? And ultimately, really aspiring to get to what we instinctually want to be, or a place that we instinctually want to live in, which is, you know, a thriving community as described by the core conditions. Okay, next slide, Nicole. So one of the things that we did in the City of Santa Cruz was we went forward with a listening session and really tried to think about, gosh, you know, where is Santa Cruz right now? What do we already have in place? We have many things that are already in place that are contributing to what a healthy Santa Cruz looks like. And how are we hearing from our community? How are we hearing from our stakeholders? How are we hearing from our employees? And looking at what our foundation is for health in our community. And that really led to this comprehensive implementation plan and work plan that really is guiding our work moving forward. Next slide, please, Nicole. And essentially what the council adopted was a series of recommendations. And as you can see on your screen, we're looking at the adoption and how we move forward with an ordinance. And we were really purposeful about an ordinance because an ordinance is an out-facing legislative action that really shows our commitment to wanting to see this through. Looking at council policy, how is that driving our internal work? Looking at how are we, one of the things I'd say also specifically about health and policies is that it's really not about doing more, but it's about doing things differently. And one of the things that we looked at is how can we just make some subtle shifts, such as incorporating the pillars of equity, of sustainability, of health in our agenda reports. But that also requires training so that folks understand what these elements mean in terms of their work and their role as city employees. And ultimately, how are we tracking and monitoring our ability to see an impact here? And that, I think, really takes us to what we as a city wanted to do in terms of alignment with other initiatives such as CORE. And then just lastly, I will briefly mention that we did allocate a portion of funding to see this through. And I think that is hugely important because we have to recognize that if this is a value of our city, that this also needs to come with some resources. And again, this isn't us saying we want to completely undermine our past practices. This is us saying we want to transform our practices in a way that incorporate health, equity, and sustainability, so that as we make decisions about parks, as we make decisions about transportation, as we're thinking about recovery to COVID and economic implications, as we're talking about a number of different policies, land use, as we're building our downtown and thinking about childcare. I mean, all of these are interconnected. And so we need to make sure that we have those resources behind us. And then I'll just end with one last slide. And I know we have a nice full presentation. So one of the things that we wanted to talk about in terms of our relationship to this effort here at CORE is that, as Nicole described earlier, really how are we complementing and aligning synergistically with the core conditions for health and well-being. And as mentioned, thinking about health and wellness, thinking about the intersection between all of these elements that go into our decision-making and our partners' decision-making, but ultimately centered around equity. How are we moving forward in a way that's synergistic to CORE and other initiatives so that we're measuring our ability to track well-being? And, I just, on a real brief and personal note, I will just say, I'm really proud of the City of Santa Cruz for championing this. I think that one of the great things about local government is we can be innovative and do what we feel is right for our community. And sometimes that can catch on to other jurisdictions. So as we move forward, as we continue to seek opportunities for recovery, my hope is, and I think I can say collectively the hope of the City of Santa Cruz is, that we can be holistic in our response and move forward in a really health and equitable way. So I know we have a wonderful presentation. I appreciate the time to give that brief context for the role of the City of Santa Cruz in health and all policies.
Thank you so much, Martine. This is Elisa Arona. I'm the Executive Director of the Health Improvement Partnership in Santa Cruz, and I'll just follow that up by saying that it was an honor to speak at one of the City of Santa Cruz's council meetings in support of their ordinance. And I was also joined by the then Mayor, Francisco Estrada, from Watsonville, who also spoke about the potential for health and all policies to spread throughout the county, and some of the work that Watsonville has also done in that direction. So it's just really exciting time for us to all be together, and a real pleasure to be with all of you in what at HiAP we're calling now a telecommunity, and just really focusing on this topic of health and all policies and our collective community commitment to health equity. So as I said, I'm Elisa Arona, and the Health Improvement Partnership is, for those of you who are not familiar with what we call HiAP, we are a consortium of the healthcare providers in the County of Santa Cruz. And this collaborative has been active in this community for 15 plus years. And it includes a number of partners, and I'll just list them because it might help those who aren't familiar with HiAP understand who's represented within HiAP. We have foundational partners such as the Medi-Cal Plan, the Central California Alliance for Health. We also have multiple county departments, including the Health Services Agency and the Human Services Department. We have the 3 hospitals and our new hospital system partner represented, medical groups, and the Santa Cruz Medical Society. In the last couple years, we've had new members join. I'm very excited for Encompass Community Services and Janus of Santa Cruz to be part of the coalition. And Hospice of Santa Cruz has been a foundational partner, as well as 3 philanthropies granting in health. Those are the Community Foundation, the United Way, and the Powder Valley Community Health Trust. So as you can see, this is a multi-sector partnership, and I would say that all of these partners within HiAP are committed to having all people in Santa Cruz have equal access to the healthcare that they need, to have the quality of care, for us to be in a continuous quality improvement approach to providing healthcare in this county. To say a little bit more about what HiAP does and why we as a coalition are championing health in all policies. Our programs and initiatives focus on achieving improved care and access and better health outcomes, especially for the most vulnerable in our community. Some of our programs include the Safe RX Santa Cruz County, which is a coalition focused on addressing substance use disorder and reducing the number of opioid deaths in our community. We also sponsor the Safety Net Clinic Coalition, the Integrated Behavioral Health Action Coalition, as well as we have been incubating Data Share Santa Cruz County, which is a web-based platform for data all about Santa Cruz County. I just want to mention that I'm honored this morning to be joined by fellow HiAP team members who are leads of these coalitions that I mentioned. So I will be joined in facilitating a breakout session with Rita Hewitt, Shelley Barker, and Maritza Lara. So the health pillar of health in all policies really reflects the hope of the HiAP partners that we incorporate a health lens into all that we do within all of the sectors of our economy. And so that we can see the results of a thriving community, regardless of where people live, regardless of their socioeconomic status, the type of health insurance that they have, or whether they're a US citizen. At HiAP, we're very excited about the potential of health in all policies to spread throughout the jurisdiction. So our small and large cities, the entire county of Santa Cruz. We really think this framework has a promise so that we can all be approaching our challenges and also achieving the health equity that we want to see for all in our community. So I'm honored this morning to be introducing Mimi Hall, who is our fearless leader of the Health Services Agency. She's the director of Health Services, which also includes the Public Health Department. Mimi is a member of the HiAP Executive Committee and has been a champion for health in all policies in the several conversations that we've had within, most recently within our HiAP Executive, to really talk about how, as a collaborative and as a coalition of healthcare providers, we can move forward with health in all policies. With the onset of COVID-19, as you all know, the priorities and the focus for the county have really shifted towards the pandemic. And Mimi and her team at Public Health have been at the helm of those efforts to contain the virus and to keep the residents of our county healthy, safe, and continuing to prosper despite all of the challenges. I know that we all share a deep gratitude to Mimi, to Dr. Newell, our public health officer, to Jen Herrera, our chief of public health, and all the others that have mobilized within the county of Santa Cruz. These are all part of the COVID COVID-19 response team who have been all hands on deck, just really focused on, like I said, keeping people healthy, also keeping people informed and having a unified message of how we can respond to this virus and how we can be resilient and come out of it healthier, hopefully, and more equitable. This is obviously an unprecedented time, and I think the leadership of the county's team has really demonstrated their commitment to equity. So with appreciation and admiration, I want to welcome Mimi to share her insights and her thoughts on COVID-19, on equity, and on health in all policies and its promise for our community.
Thank you, Elisa, for that really, really kind and thoughtful introduction. And thank you to Core Coffee Chat and also Martine for the work that you have led in our community towards health in all policies to increase the capacity of all of us, because it's collectively that we're going to make changes in our community, not separately. And so I'm really appreciative of an opportunity to talk about COVID response and recovery and how we have used the lens of equity and health in all policies in our response. Next slide. So as Elisa said, Health Services Agency is the agency that is the umbrella for our local health jurisdiction, which is our public health division serves as our county local health jurisdiction. And our vision and mission is something that's just very difficult to argue, and it has the equity lens involved or embedded in its simplicity, which is better health every day for everyone. And our mission is to collaborate with the community to protect, promote, and improve the health and well-being for all. So when we knew that we had to activate our Department Operations Center in response to COVID, it didn't mean that we left our vision and our mission behind. Next slide. So how did we embed equity in COVID response and recovery, and why did we do it? I actually didn't start as the incident commander of this incident, the official local emergency incident, until April 8th. And when COVID first started, we weren't quite sure where it was going. I think we were one of the first counties to activate our Department Operations Center in response. We did that in February, and we kept a close eye on what was happening with the trajectory of the disease, both internationally, nationally, and in California. And when it looked like it was really going to be something, we kind of changed our structure around, and I stepped in as incident commander on April 8th. It is at that time, so I don't know how much any of you know about the incident command system, but it's a federal response system that goes all the way down to the local level. And every incident has an overall set of objectives for the response. And not surprisingly, our main objective was to reduce death and illness from COVID-19. But one of our main objectives also is to address COVID-19 through an equity lens. So it was important to add that objective soon after we started realizing how impactful this was going to be in our community. So not surprisingly, what we expected with COVID-19 came to fruition. Health disparities, as we all know, there are disparate health outcomes for vulnerable populations across all of our communities, and they've been present for years. And we know that there are certain groups who suffer more from cardiovascular disease, diabetes, asthma, obesity. And what we also know is that these conditions increase risk for COVID and for poor outcomes and death from COVID. So what we set out to do was make sure that we had the ability and the eye for examining the disparate nature of this new epidemic, now a pandemic, with other diseases and solutions and implications towards equitable outcomes. The other thing that became clear as we started following the epidemiology of the disease these last few months is that there was one group that didn't have the choices that were available to others, which are the essential workers. So many folks in our community had the ability to work from home or work remotely. Our essential workers have never been sheltered in place. So those who work in agriculture, those who work in hourly wage jobs, those who work in our grocery stores, all of the essential workers maintained as usual throughout the pandemic, and they still do. The other thing that was clear to us is that you can't have a community-wide response to something that permeates our entire community without leveraging and relying on the community partnerships that are already in place. And so it was imperative that the work that we did move forward, partnering not only with the local health system, but also existing partners in our community. Next slide. So these were some of our goals in terms of incident objectives and the COVID-19 equity lens. We knew that going forward, we were going to commit to collecting, monitoring, and assessing the data that we received geographically, across racial and ethnic demographics, as well as socioeconomic disparities. And we're going to use that data to inform our planning and our implementation actions from a response perspective, so that we could be responsive and resilient in our disease mitigation. You know, this incident is different than an earthquake or a flood or a fire, where you make very, very quick decisions, which are kind of the same for everyone to get a quick control over the incident. COVID is very, very different than that. And so we knew that we had to have this long-term outlook on that included that equity lens. The other thing that we knew is that there were going to be resources, but limited resources, to address our COVID response. And that disease is not just about transmission, but it's about those social determinants of health that put people more at risk for disease and also more at risk for poor outcomes. So we made a decision early on that when we received dollars and those resources needed to be distributed, that they were going to be done balancing disease control with the social determinants of health. And as I mentioned earlier, we only have 5 core ICS incident objectives, and they're all related to death and disease and data. And the one that is driving the response with a lens across all of those things is our equity lens. Next slide. So I wanted to spend a few slides just talking about what we're seeing in California and how we're using that data and how we've made a concerted effort to collect our local data to help us respond through that equity lens. So this is no surprise to everyone. These are July 19th numbers. The state has a small delay, but we had a daily increase of 9,329 cases across California. And what we're seeing is that there are far more cases in the 18 to 49 younger adult age group than any other group. And it's probably for 2 reasons. One is that many of them tend to be the essential workers, but 2, which is more likely in the trend that we're seeing now, is that this is a group that's grown tired of staying at home and sheltering in place, especially the younger adults. Many of them have moved back home with their families with job loss and other things. So next slide. This is the state's breakdown of positive cases by race and ethnicity. And you can see that, so the gray lines that you see that are up and down, the gray vertical lines, show the proportion of that population of California's population, and then the blue line is the positive cases. So if cases were distributed equitably, you would see the blue lines being right around where the gray bars are. But as you can see, our Latinx populations are very much disproportionately impacted by COVID-19 when compared to their proportion of our population. Next slide. I'm sorry, something popped up on my screen and is covering it. Okay, I got rid of it. So California's statistics, this is a little bit busy, but it shows not only our positive cases by race and ethnicity, but it also shows who's impacted by COVID deaths. And it's just another reminder that this disease isn't spread evenly across all of our populations. And now I'm going to show you some local data, case demographic data. The next slide. So the dashboard is actually updated this morning. And this is something that's sobering. This was yesterday's dashboard, 772. And we actually had a delay in getting the information from the state CalReady system yesterday. So today's dashboard, if you go, and I didn't have time to do it because I had meetings before, this is actually 830. So you might recall the days when it took us several weeks to get over 100 cases. And now we're at the point where it's highly likely that we're heading towards the point where we'll see over 100 new cases a day pretty soon. And that's very sobering. When you look at the pie chart on the right, this is the most likely source of exposure. And one of the things that is important to mention, and it's important in the populations most at risk, is that by and large, the way for the cases that we have investigated so far, and those 351 cases under investigation, many of those cases just came in the last few days. But by and large, we have an understanding of where people are getting transmission, and it's typically a close contact or close household contact. Next slide. So this is the breakdown of our numbers in terms of our own county population proportion compared to what we're experiencing in known cases. And if you look at the lower left chart, you can see that our Latinx populations make up about 50% of the cases at this time. This was a couple of days ago, although that their proportion in our county is more like a third of our county population. Our trend is following the same trend as the state in that there are the vast majority of our known cases are in the 18 to 34 year group. You can also see in the known cases by jurisdiction that we have far more cases in South County, in the Watsonville area, than we do in any other area of the county. Next slide. So once a week, our epidemiologists break down our data based on race and ethnicity. And we have had very few cases that were multiracial or other race besides the non-Latino Hispanic or Hispanic Latino. And until we got greater numbers, we didn't want to break those down even further for privacy and confidentiality reasons. But you can see that the green bar represents Latinx communities. And in the very beginning of the pandemic, looking at early April through the month of April, you can see that those folks, the cases that were coming in were in the very beginning white or Caucasian ethnicity. And then throughout most of April and May, it was rather evenly split. Then what we started seeing, and this could be as a result of social determinants of health, such as status as an essential worker and living conditions. As the pandemic progressed, we could see a greater proportion of the Latinx populations becoming a greater, more of the known cases of COVID. More recently, in July, we're seeing a little bit of a shift in that data. And I think that from an epidemiological perspective, it really is that we're experiencing more widespread prevalence in our community. And then we also believe anecdotally that the change is as a result of the 18 to 34 year group, which it seems are accounting for a greater proportion of the white and Caucasian demographic. Next slide. We also have been tracking likely source of exposure. And what this slide basically shows is that as time goes by in the pandemic, we're more and more likely to be able to identify how people acquired COVID, and it's usually through person-to-person spread. This is important information as we try to curb and contain and mitigate the spread of COVID, especially in multifamily and large households. So next slide. So what did all of this tell us? As we were working through collecting data, because all of public health is based on using data and information, especially in a pandemic, from an epidemiological monitoring standpoint to inform our response actions. So knowing that what we were experiencing and the demographics and the epidemiology of this disease in Santa Cruz was actually no different than we're seeing in California and the rest of the nation, we knew that there were a few things that we were going to do going forward to ensure that equity was embedded in our response. And the first is that our testing and tracing plans going forward have got to invest in our most at-risk populations. And so that was borne out in the next bullet point, which is our CARES Act funding requests. So the county has been, has received an allocation to be expended by December 31st of this fiscal year, or of this calendar year, for federal CARES Act funding. And what we did was we made a funding request to the county, which was due July 17th. And this is not just for the public health response, it's for the entirety of the county response, including shelters and safety and law enforcement and changes to public works and all of those kinds of things. And so in many counties, those dollars aren't being distributed to public health. In our county, we were allowed to make a request to help bolster our public health response. So our CARES Act funding requests totally match and align where we see the interventions are needed to support the populations most impacted. We will know of our request by August 4th, which is the board meeting in which the board will approve these requests. But just to give you an example of the areas of funding that we put in, of course, we requested funding for testing and tracing. However, those testing and tracing plans are firmly embedded in our local healthcare system and our local safety net system. And in addition to that, we have requested substantial funds to be provided to UndocuFund to provide economic and social supports to families who may be presenting to any of our FQs that may need those supports to protect their families from COVID. And then we've also requested substantial funds for our community partners who will be providing support services, education, and outreach. So that is our piece of advocacy, because all of those things need to support the public health response. We're also focusing on the social determinants of health and our isolation and quarantine plans and measures. So part of our request has been to substantially expand the housing. It's actually hotel housing available for isolation and quarantine, because what we're finding is in our most recent half dozen or so clusters, and actually our clusters going back to Mother's Day, the most likely cause of spread and reason for spread was living in a large or multifamily household. The other area where we've requested funds to support is to engage communities in that we serve in creating their own messages and interventions through a collective impact communications model. And then finally, we are working with BARHI, the Bay Area Regional Health Inequities Initiative, and Rise Together to continue to work as a set of multiple counties in our region to share the ways that we are infusing the equity lens into our COVID response, and then how we can sustain that for the long term. As a part of that, we met with HSD, and we're committed to joining the Government Alliance for Racial Equity so that we can have support as a county organization or a set of county organizations. And we haven't done it yet, but our goal is to ask our board for the county to join GARE for county overall membership. So the county organization is a member of GARE, not just their Health and Human Services. Next slide. And so looking ahead, what are we doing in terms of what have we learned and what would we like to keep in terms of sustaining some of the infusion of equity in what we're doing. As always, before COVID, we can't do our work without partnerships. So throughout the response, we have had weekly calls with a number of different partners at all different levels, and we've tried to also keep up with the number and types of communication. So we have weekly calls with SNFs, with community partners. We had our consultant on loan work with Pajaro Valley Communications Group or Community Group, and that will continue. But really leveraging the partnerships that we have going forward is going to be important, especially in the use of the implementation of the measures that we've requested through the CARES funds. Advocating for investments in equity, it's what we've done from the beginning of the pandemic, and now that we have substantial funds, although when you look at the size of the response that we're responsible for, no amount of resources seems to be enough. We are advocating for those social as well as resource investments to be equitably dispersed to stakeholders and partners and health systems in a way that serves communities most at risk. And in terms of looking forward, I think that it was a huge lesson for all of us to know that we can permeate into our systems and into our policies, as we did with COVID, through our overall objectives. So for this instance, it was including equity as a key incident goal and objective in the incident response plan. But it was clear to us that we had to start at that place. And when we have our regular and weekly action plan meetings, when we plan for how we're going to deploy resources for testing, for tracing, for community supports, for isolation and quarantine, it always begins with that equity lens. So I think that our opportunities to leverage that lasting change are to learn from what we've done already and to maximize and leverage the relationships that we continue to fortify with our partners who serve our most vulnerable communities before COVID. And as I said early in my presentation, COVID only put a magnifying glass or kind of exposed the weaknesses and the disparities already in our community. And we are committed to continue leveraging the partnerships that we're investing in right now to continue beyond COVID. It's been a really, really humbling experience, and there's always more that we wish that we could do. We're all exhausted, but we haven't gotten this far without all of you. And so that being said, I just wanted to thank all of you who have been along this journey with us, joining us either on our Tuesday morning calls, our Wednesday morning health system calls, our healthcare coalition calls, because everything that we do is in response to the needs of the community and what we're learning, both from the epidemiological data that we see and what we're hearing from our community partners.
Thank you so much, Mimi, for everything that you're doing and for today's presentation, which is such a great update and so linked to our core conditions and other topics. So we appreciate your time. We know how busy your schedule is. We have a couple minutes for questions while we still have Mimi, so please keep those coming in the chat. We won't be able to get to all of them, so we'll do our best to send out something after our chat today. But Mimi, one question that came in from Denise is how stigma is a barrier that has implications for poor health outcomes. How can we as a community strive to reduce stigma and promote person-first language and reduce the use of labels that impact the community negatively? Wondered if you had some thoughts on that.
Yeah, I think it's really important for us to think about in all of our community messaging, you know, because we're all of, because we work with these populations often, and I had never thought on the flip side of that person-centric language. So I think that we can all use that lens and check ourselves in the communications that we do, in the language that we use. And I think that we might have an opportunity moving forward to adding that to something that we can come to agreement with as a set of partners. I mean, when it comes to racial equity, when it comes to, you know, all of those things, we come together as a community to agree upon the language that we use. And I think that we have an opportunity to do that with COVID as well.
Thanks for that. And Caitlin's got a suggestion in the chat for everyone too about using the involvement and bringing more voices into these conversations. Yeah. So always a good reminder.
Yeah, actually that's one of the plans that we have moving forward with our collective impact communications. And I know we don't have a lot of time to talk about it now, but one of the things that we'd like to do is tap into the existing partnerships and groups, including CORE and HiAP, the Pajaro Valley Community Group, to implement this collective impact communications model, which will be designed to both engage the community proactively, but also tap into the use of credible messengers and also infuse funds across the community. And so we're waiting on approval for our CARES Act funding request to the county to know that we can move forward with certain aspects of that.
Okay, great. And Elena had asked earlier about clear, unified health information located where everyone can find it. I put a link to the Health Services Agency's COVID-19 updates on their responses, where you can see some of the data that Mimi shared with us today. But we're going to move on to the next part of our agenda. But Mimi, thanks again. And we are so lucky in Santa Cruz County to have this proactive, forward-thinking group at the helm. So we really appreciate you and everything your colleagues are doing. So I'm going to turn things back over to Shebra. And if you want to keep your questions coming, we'll keep collecting them. So we'll keep moving. We're going to have a chance now to transition to some breakout sessions where we'll have time to discuss all of these things in a bit more detail. And Shebra is going to guide us through that.
Great. Thank you, Nicole Lezin. My name is Shebra Kalantari Johnson, and I've been working with Martine Watkins and Tiffany Wise West at the City of Santa Cruz with the Health and All Policies work. Thank you so much, Mimi. So much work, incredible work that you and your team and the community have been able to do in a very short amount of time. So I appreciate you taking the time to break that down for us. So this next session, we really want to invite your thought partnership, all of you who are on this call, to help us think through some of these questions that we have up on the screen. So I'll read through them. The first one is, what has been or is missing in our systems? And how do we do things to ensure health and health equity? What systems have been adaptable and resilient, and how? And what are we doing in response mode that should continue as we move forward and into recovery? So you will be assigned to one breakout room that will have one of these questions. We will have facilitators in each room. Facilitators will include the HiAP team, Elisa, Shelly, Maritza, and Rita. The Santa Cruz City team, Martine, Tiffany, and myself, and Caitlin Brune. So each question will have a facilitator. You'll be assigned to a question. If you get into a breakout room and you're like, darn, that's not the question that I wanted to respond to, it's okay. You'll have an opportunity when we come back and we do report backs to share your thoughts with us in the chat boxes. If you do not wish to participate in the breakout rooms, but want to stay on and come back for the report backs in the end of this webinar, put an asterisk next to your name. That's your Zoom name. So you can go and click on the right side where there's the dots, and you can say rename and just put a little asterisk next to your name if you do not wish to be in a breakout room. So you'll have about 15 minutes in those breakout rooms. Again, this is an opportunity for you to share your thoughts and your ideas on these 3 questions. So I think with that, we will move into breakout rooms if we're ready, Nicole Young.
Okay, I think we have everybody back successfully. And so we're going to take a few moments just to hear a quick report out from each group. And so we're going to ask the facilitators to take up to 1 minute to share one highlight, one takeaway from your group's discussion. And why don't we start with the facilitators that were discussing question 1. So how about Elisa? You want to go first?
Sure, happy to do so. So I had the pleasure of speaking with Jenny Dushek, and she's a science writer, and she has been working on, with the City of Santa Cruz, potential a plan to address climate action. And so we had a really interesting discussion of that intersection between environment and health. And she brought up the issue of sea level rise and impacts, for instance, on beach flats. We also talked about heat and how we can continue to expect the days, hotter days for longer periods of time, and the impact on agricultural workers particularly. And I think the general kind of question here was, and what is missing is, what's the plan? And I think sort of as maybe a human race, we tend to think of what's ahead, right in front of us, and how do we deal with what we're dealing with today, but what's the plan for these future environmental issues that are going to have serious health implications in the future. And then I'll just wrap up by saying that we also talked about the fact that it's missing in our systems and in our approach to governance and policymaking, that connection and really listening to people and listening to communities about the solutions that they have, about the issues that they see, and how they can be resolved using the assets of the community.
Thank you, Elisa. How about Nicole Lezin? You want to go next for your group that discussed question 1?
Sure. We had a wide-ranging conversation. We had people in our group who were familiar with issues from behavioral health to oral health to the unhoused and to the environment. So we touched on all of those. And a couple things that really were highlighted were things like the health system already being so broken, and then how this crisis has really exposed that, and as well as the difficulty of addressing it. So people not having access to insurance and care and coverage, but also that being tied to things like employment. So if you lose employment, you lose your coverage. We talked a lot about the role of trauma, people who are experiencing homelessness, trying to do their best to wear masks, but that's sometimes difficult when it's a more distant issue than immediate needs. And we also talked about children, just that how isolating this is, even in the best of circumstances, the most privileged of circumstances, but how hard it is to have just the normal social opportunities to play, for example, and what could be done to connect kids to each other in a safe way, especially if their parents are working as essential workers or feeling pressured to work outside of home and having unsupervised time. So all of those came up and much more. So group members, feel free to chime in. We also had a long discussion about, or comments about, how as difficult as COVID is, it pales in comparison to some of the environmental climate changes that are coming, and how the good that can come of this is to redistribute resources back to the communities that they were extracted from to make things more equitable and fair.
Great, thank you. That reminds me to invite everyone, if you want to add something that came up in your group and you're not actually verbally reporting out, feel free to add that to the chat box because we'd love to be able to see it and still kind of capture all that as we move quickly through these report outs.
Great, and Nancy's demonstrating that with sharing a resource there in the chat. Thank you.
How about Shebra?
Great. Yeah, we had a great discussion with our members. Just some of the synthesis points is that it's absolutely essential to respond to immediate needs, but one of the things that's missing is stopping and pausing and taking a step back and thinking about these systems gaps and thinking about upstream and preventative approaches. Really, when we think about that, then really investing in our root causes. So balancing that response mode, immediate response mode, so a matter of life and death in some situations, but investing in root causes. And so we had a couple of examples. One example was overcrowded housing, which translates in a lot of ways and impacts people's health, and it impacts housing insecurity and homelessness. So when we think about overcrowded housing, how can we take a step back and look at our zoning and our planning and then put it into terms of building more housing units and thinking about affordable housing and putting those in place to address those issues. One other example that was brought up through chat after we had ended, so some of my group members didn't hear this piece, but Najib added this point, is that this is also connected to racial equity. So understanding that communities of color have been impacted by longstanding institutional racism and historical trauma. And these impact their ability to have access to resources and have, of course, health impacts. So those are some of the points that we discussed in our group.
Nice, thank you. And then moving on to question 2, how about Shelley? Can you give your report out?
Yes, I had the pleasure of interacting with Ali Hayes, and I think the highlights from our discussion are that we felt that the areas where we've seen adaptability and resilience are really in the areas of telehealth and teleeducation, and people really quickly and nimbly operationalizing and scaling the ability to interact remotely in those ways. We delved a little more deeply, specifically in areas of behavioral health, and talked about Narcotics Anonymous and Alcoholics Anonymous offering online venues that, and so one of the hows that came forward with that was that really that doing online interactions can sometimes avail ourselves to connecting with others at times, clock times that might otherwise not have been real available, like an example of an AA meeting on a late Saturday evening when maybe the venue that from the previous physical health session might not have been available, but it's certainly a time that's helpful for people to meet their needs. I think another layer that we brought forward, another system, is really responding to some social determinants of health quite nimbly, and specifically food assistance. And Ali brought forward the example of her awareness, and in San Lorenzo Valley, prior to COVID, there were national school lunch meals available, breakfast and lunch, and then also food distributions at schools for additional meals for families. And so they have worked together to do some fundraising and basically kind of replace some of those meals with the food distribution in terms of Safeway gift cards, and so collective fundraising, and then also maintaining those school meals. As I know for my family, I received the notification last night that school will be remote, but also that meals will be available daily at the school sites. So that's my quick summation, and it was a pleasure.
Thank you. And Martine.
Great, thank you. What incredible insights so far. I'll just start by first apologizing to my group because I prematurely left our discussion to come back to the main group. So, but in the interest of time, I think I'll just briefly sort of share some of the things that stood out to us, and a couple of things really stood out. I think the theme of education in terms of the ability to mobilize quickly, to get Chromebooks out to families, to try to get hotspots to families, to try to track down those students who aren't aren't being responsive, or the families that we're having a hard time reaching. That's been really an incredible adaptable kind of example. The other that stood out was funding and grant funding, just saying, gosh, we're gonna go ahead and say, do the work and don't worry about the reporting, don't worry about these sort of generally cumbersome type of grant requirements, but right now just go do the work to serve the community. And then I think the one that also just stood out, I think throughout all of the themes, is really just this building on existing partnerships and collaborations. And you know, Corinne from our county, who's doing some of the public health communications, shared how we're working through our existing partnerships and collaboratives to ensure we have very clear and transparent and comprehensive communication. And we've seen that throughout the county, but also throughout education. And that's been a real benefit to seeing some of the adaptability of our systems at this time.
Thanks, Martine. And Caitlin was the last group talking about question 2.
Great, thank you, Nicole. And thank you, Diane and Claire and Yvette, who brought forward just fantastic insights. That point that Martine made about clear communication that really supports planning came forward in our conversation. And there was a remark that adaptability is always to ensure safety. So as we look at this moment and take stock, how do we plan with the fears of being sick in mind, given the necessity that some people face of having to go back to work on the front lines where the exposure is greater. And the system that we wanted to uplift was both motherhood, parenting, and family care generally, and how parents and mothers have really risen to meet incredible and significant new demands on them, and the early care and early childhood care environment, which in many cases at the nonprofit and community level just continued without interruption while working to adapt in ways that ensured safety for the workers and the families. So really uplifting families and trying to think creatively about how to strengthen the web of support around families. Thank you.
Thanks, Caitlin. And so that's a great segue then to our report. That's about the last question about then when we think about not only the gaps and what's missing, but where if we've seen signs of resilience and adaptation, what are the things that we're doing in response mode that we should continue as we move forward with recovery? So let's hear first from Tiffany, and just a quick time check. We are right up against our time limit here. So our last few facilitators, if you can give us a really concise report,
yes.
That would be great.
Yes, I'm going to go very quickly. I just wanted to acknowledge Denise Ellerick, Becky Russmore, and Susan Cavallari for a really robust and diverse conversation. I think our top takeaway has to do with people experiencing homelessness and the fact that there were outreach services pop-ups sites and low barrier shelters coming on so quickly, really speeding up what could have been 2 more years of conversation. So really wanted to point to that. We also did discuss quality of life and environmental efforts. And I'm going to put in the chat a really great New York Times article that just came out yesterday on this topic, keeping things like telecommuting, slow streets, but are we really addressing equity in those efforts? That's all I'll say. Thank you, everyone.
Great. Thanks, Tiffany.
You're welcome.
And now we have Maritza.
Thank you, Nicole. And I want to acknowledge Karen, Diana, and Amy also for the great conversation we had. We were talking about just the disruption that we're experiencing through COVID and how this disruption has shifted the conversations we're having. We're finally seeing people as people in all their dimensions. We are really centered in collaborating and figuring out like how do we stay connected during this time. And one of the big takeaways was, as we move into the future, how do we not lose what we have gained through this pandemic? And so there's a lot of things that could be done. I personally am thinking, you know, how do I not lose everything that I have learned? So I'm going to start journaling about it. And so that's my, you know, advice, or find something that you might want to do now that might help you. If it's that tattoo or something like that, go for it. But let's not forget what we have learned so far.
Great, thanks, Maritza. And then last but not least, Rita.
Thank you, David, Jenna, and Ellen for our conversation. Overall, as a group, we seemed really impressed with how resilient and responsive our community has been. And we want to continue that moving forward as a collective effort together. And I think I'll echo just what everyone else has said, and then an increase in general flexibility, whether that be telehealth appointments for Matt, medication-assisted treatment, increasing access to services to therapy. We talked about, you know, being able to see maybe a specialist that you would have not normally been able to access if they're far away or whatnot. So overall, less barriers, and being able to meet more often. I think we've seen that in several of our coalitions and works that we're talking about, is the flexibility to meet more frequently. And we also talked about the data sharing, how that's been keeping people informed and deepen our understanding of that effort. And we want to continue that moving forward. So I'll stop there, and thank you.
Thank you all. So clearly a lot of challenges and gaps, but also some bright spots and things that we could definitely build on to, again, get us through both the current crisis and into the recovery phase. And I know for me, it's bringing up a lot of ideas about future topics for other coffee chats. And so at this point, I'd like to turn it back over to Shebra to summarize some ideas for a call to action after this.
Great, thank you. And I know we are at time, so I'll just very quickly read through, I won't read through these, but I'll summarize. Our call to action to myself and to all of you is to invite you to really inquire into your own organization and spheres, and really look at health equity, what is needed in terms of training, what is needed in terms of partnership. This was brought up by Caitlin earlier, is that really engaging and bringing in more voices, so engaging the community and inquiring about how services can be shifted to address health equity. And holding, and Najib brought up the point that lenses can be taken off. So holding an equity framework as we develop our evaluation for programs and projects. Thinking about childcare, that's come up in a couple of ways. How can we promote and recognize that childcare is a real issue around equity and health equity? And then looking at telecommuting policies for organizations. Clearly we can do this in we can work in creative ways. And if there are others, we invite you to put in the chat box or communicate with the Nicoles. What are some other ways that we can all, in our everyday lives and in our organizations, promote health equity? So I do want to quickly make a few acknowledgements. I want to thank Mimi and Health Services Agency and the whole team for the incredible work that they are doing on a day-to-day basis to keep our community safe. I want to thank the Nicoles and the Core Coffee Chat for just creating this space, not just for today, but for, I've joined several of your conversations. This is really important, more important now than ever, to have our community come together around these important topics. So thank you. Health Improvement Partnership, your leadership in what you do in the community and your partnership on this webinar. And the City of Santa Cruz for their leadership in moving forward and implementing health in all policies and showing us all what's possible. And all of you for the conversations that you've had, for the steps that you're doing every day to ensure health equity in our community. So thank you all. And I'm going to pass it back to Nicole Lezin.
Thanks, Shebra. Thanks, all of you. I know we're out of time, so all I want to say is thank you. Please fill out our feedback survey. Stay tuned for more. We're trying to figure out an August schedule, but we'll get back to you. You're all on our mailing list and you can't get off. So thanks again, and keep doing all the great work you're doing. Stay safe and healthy, and we'll be back with you soon.